Hello, and welcome to Health and Fitness Redefined. I'm your host, Anthony Amen. Join me today as we take a dive into the world of health and fitness, where we learn to overcome adversity, to pick fact versus fiction, and see health and fitness in a whole new light. Today, ladies and gentlemen, we're going to talk about being pregnant, something I know about, but I really don't know about. And I know a lot of our listeners are going to be like, well, you're a guy, you have no kids, and you have no right talking about this. So that's why I'm bringing on a guest, because hopefully we can learn something about what it means to exercise while I'm pregnant, and hopefully take and learn something from that. But before we introduce our guest, guys, don't forget, check out our Patreon account. It's all new. We started it a few weeks ago. It is courses for those that are gym owners, personal trainers. If anyone wants to take their game to the next level and learn from me about how I did it, how I've created a successful company, I'm here for you. So without further ado, let's welcome to the show, Daisy. Daisy, welcome. It's an absolute pleasure to have you here today.
Oh, wow. Thank you. I'm so glad to be here. I'm actually just loving your energy. It's bringing me up, getting me going. So I want to thank you so much for having me here today.
It's an absolute honor to have you. I know you were saying you're in right outside of Denver and you're stuck in a snowstorm.
I know, and I actually live in the mountains, and so after I'm done here, I'm gonna hike up the back of my hill and take the dogs snowboarding. So that's one of the benefits of living out here is I actually just get to exercise right out my
Wait, you're going to
backyard.
take the dog snowboarding or you're going to
Oh,
go
well, they
snowboarding?
don't actually get on boards, but they follow me around and they run like crazy and, just have a blast in the snow.
I just imagine it's two huskies that are just following you around, chasing each other in the snow.
Oh, they're golden retrievers and they're a little clumsy, so it actually is pretty funny.
So it's adorable. I love it.
Yeah, it's pretty cute.
All right. So besides having two golden retrievers, we want to hear about Daisy. What got you into the fitness realm and what kind of got you started into this field?
Sure, yeah, it's kind of a hard question to answer, and it is a lot for, a lot of trainers to answer too, because we all have this disconnected journey that kind of is all over the place. And I'm the type of person that I've loved fitness and been in sports since as far as I can remember. And I really did not know what to do with myself in school. So what did I do right after school, high school is I went through and I got my personal training certifications. I didn't know what else to do with myself. That was the only thing that I loved and was interested in. And I didn't really want to be a gym teacher, but I did want to work with people. I wanted to help them improve their lives. So that kind of is what got the ball rolling. And I've worked at a number of gyms throughout my career. A lot of them were, women specific gyms. And, I got into the field. And as you may know, being a trainer, there is really not much information that is taught in a general personal training certification that addresses a lot of the needs of pregnancy and postpartum women. So I kind of was learning as I was going. I was faking it till I made it. I probably made a lot of mistakes along the way. And I really just didn't know how to grasp these women. And I noticed that a lot of trainers kind of were in that same boat too. We either like treated them like they were, normal. So we're like, go, 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 you can do it. Or on the other hand, we were like totally afraid of this group of women. And so I've seen a lot of trainers are like, yeah, let's just go do some general stretching. So that's kind of what planted the seed in my mind that this is probably something I needed to learn more about. And, through training, I also went to massage therapy school and really focused on more of the corrective exercise and kind of soft tissue, post injury, like rehab sort of work. So I've always worked in sort of this realm of where I really like to help special populations. And after my certification for massage, I spent a lot of my time working with CrossFit athletes and helping them stay on top of their game, helping them with the injuries that they were dealing with, working on, rehab sort of stuff. And I fell in love with CrossFit at myself and at that time. And it really took my fitness to the next level. And I actually started to like the way that my body looked. But I kind of got to a certain age where if I wanted to have kids, it was actually time to start making that happen. Now, like a lot of trainers, I'm kind of type A. And, you know, I want to know everything and want to do everything well. I want to be that type of person that, I could pull this off and say that I'm stronger, I'm fitter than ever. And I did this all while I was pregnant. And I knew from my training with women days and the education that I had received throughout the duration of my career, I knew there was like a huge gap still and I really didn't know how to help myself, and I really didn't know how to help pregnant and postpartum moms truly. So I just jumped into a whole bunch of education and training. And part of me was this was driven by fear and that I just didn't want to lose all that I had worked for. Again, I really love my body when I started this. I did not want to get fat. I didn't want to turn into the mom that wore sweatpants all day long and just kind of let their body go. I didn't wanna pee my pants when I sneezed or I was doing jump rope. I didn't wanna have that pocket of belly fat that, all moms kinda reach and grab for. I just wanted to be like me, but maybe like a 2.0 me. So, I just took course after course and learned as much as I could so that I could kick my own pregnancy and postpartum butt. So, long story short, this has just kind of been a calling for me. And, through doing just learning for myself, I've the most important takeaway that I got from all these trainings is that, pregnant and postpartum women in fitness are totally underserved. They're neglected. They're not told what they need to do to take care of themselves properly and how that they can approach fitness safely so that they can be fit and strong, prevent those injuries, and so that, you know, pregnancy and birth really change a woman's body, like more than we think and more that we can understand. And so this has just really been kind of the springboard for me to kind of get this part of my career launched. And I really love working with this group of women.
How long have you been working with this area of women, the pregnancy postpartum?
This population, about 5 years now. So I've been training for over 20 years, but really started to focus on working with pregnant postpartum women exclusively for the last 4 or 5 ish years.
That's awesome. So I'm sure you've seen all different types of ranges of people starting different athletic abilities before they get pregnant, while being pregnant, after pregnancy, and seeing how exercise and pregnancy can really affect the body.
For sure, yeah. So when I first got into this, I was still working with CrossFit gyms and working with CrossFit athletes. So that is the first group I started with. I started with this uber fit, um, super determined, work through the pain, bust your butt, who care like, what is it? Sweat is, the sign that you're doing it right, or if you're in pain, you're doing it right, just keep pushing it
Sweat's
through.
fat crying. That's what we always
Yeah,
heard.
like, all of the, cliches and, sayings that go on, like all of these CrossFit t-shirts that have these crazy sayings, like "suck it up, buttercup," or, whatever. So I kinda worked initially with this population that was like, "No, I don't need to slow down. I can push through. I've worked my whole life for this. I'm not slowing down." So I kinda started with that group. So you can kinda see how sometimes it's a struggle to like tell these women, there are some considerations you need to make. You shouldn't be flopping down onto the ground in a burpee, when you are, 36 weeks pregnant. It's probably not a good idea. So I kind of started with that population. And of course, COVID, all that sort of good stuff. I took my services online, and of course, as soon as you start working online, you just open up a bigger can of worms. So now I work with women of all backgrounds. Some of them are just weekend warriors. Some of them, are just very new to fitness. Some are in it for just the aesthetics purposes. And, some are just in it for more, kind of building and they want to look ripped. So, whole bunch of, different groups of women that I see online right now.
Yeah, I'm sure you've just been exposed across the board. I want to start. I think the easiest way to break this down is to talk about my knowledge of pregnancy, which is like that, and then go into a little bit of what the public thinks and kind of branch out that
Yeah,
way. And I'll start with what I know, and I want to bounce some ideas off of you, and hopefully the listeners can really learn from this conversation. But the first thing is what I've always been taught is you can always exercise, at least in the beginning, like your first trimester, the same amount that you were doing pre-pregnancy. So if you're somebody who runs marathons frequently, you're an avid runner, and you get pregnant, you can keep running those marathons. What you don't want to do is take someone who's never exercised and then introduce the additional stress of exercise to the body. So it's adding additional stress that you want to avoid, while if you could always maintain the same amount that you already have. So branch off of that first, and let's start there.
sure. Yeah, and that's not a 100% truth. We all know that there are a lot of benefits to exercise, regardless of what's going on in your life. So, to answer that question, a lot of times it's very common you will hear if you go to your doctor's office, you find out you're pregnant, and you say, "Can I still work out? Can I still maintain?" And the answer for the most part is yes, but within a certain range. So let's just say that you are a power lifter, for example, and you commonly, you know, go for PRs. You're trying to constantly max lift. And yes, if you want to do, a heavy clean and press, for example, um, you can still do a clean and press. But for the most part, the recommendation is not to still go at it 100%. It's maybe to start working in that 75 to 80% range, um, for a lot of reasons, a lot of factors that we can certainly talk about. Now, if you take your average couch potato who's never really worked out before and they find out that they're pregnant, sure, I'm not going to tell them to go and do clean and jerks and start running a marathon, but I'm going to tell them to. Yes, you do actually wanna move that body. Um, you wanna start maybe going for something like walks. Maybe you wanna start doing, some very basic resistance training to help. A lot of women, especially if you are overweight to begin with, there are things like gestational diabetes to worry about, things like, high blood pressure, preeclampsia to worry about. So a little bit of exercise can be definitely safe for these women, even though that they've been a couch potato their entire life. And it's really just being in that happy place for you at this time. So there's a huge gap there. There's a huge range there, depending on where you started. There are a lot of women that run and lift and compete in certain things throughout their entire pregnancy, but it just might not be at this 100% competitive level. And for pregnant women, you might have to take it a day at a time, unfortunately. There's a lot of things to consider, like nausea, maybe just lack of motivation. A lot of times, depending on where you live, too. So when I was training my CrossFit athletes, uh, we were in South Florida. So a lot of the gyms didn't have really great air conditioning. So you can imagine being a pregnant woman, and you just can't catch your breath because you're just, sweating or whatever. So you're going to have to take it down a notch. So there's a lot of consideration. So that blanket statement of saying, continue to do what you were doing before might not necessarily be the best advice. So, if you are a trainer, who's listening to this and you have a pregnant client, um, who you've gone through your normal routine, just kind of, or whatever program you have for them, you might have to consider making some changes and modifications as you go. Of course, first trimester, you're dealing with, you're not, you're not showing yet. Maybe your body hasn't had those changes quite yet. But a lot of women in those first trimesters are still struggling with their workouts, mainly because of that whole nausea factor. And they're just feeling like crap, flat out. So they may still be on top of their fitness game and be able to like physically handle the harder workouts early on, but they just might just feel like you yourself, you're saying you were sick the other day, you had, like, a stomach bug. That's pretty much how they feel like every single day. So,
And
you
I
try and
gotta
work
say,
out like
it's my goddaughter's fault who's 13 months
that.
old. She goes to daycare one time, brings it back home, and we all get
Yeah.
it.
So, just like as a man, to put yourself in the woman's position, you feel like that almost, like, every day in your first trimester, potentially. So, just kind of put yourself in that shoes and try and do your regular workout, and then just kinda go from there.
Wow, yeah. So keep it in the first trimester then. So, are
Okay.
there any things besides obviously taking it day by day, watching nausea? Are there certain positions? Are there certain exercises that you should potentially avoid? Any specific things as a fitness aspect that you should watch out for while being in your first trimester?
Yeah, so for the most part, and here's the thing, a lot of women in their first trimester, of course, in those first, sometimes even 8 weeks, sometimes your clients, the women you work with, might not even know that they're pregnant. So of course you can't make any special considerations in that sort of realm. But for the most part, if they are not really showing any physical changes quite yet, for the most part, you can kind of get away with most of anything unless you're dealing with a high risk population. For the most part, you can't do too much harm. And I don't know the nature of, what sort of training, a lot of your listeners are dealing with. Um, but of course, the big thing is falls. It's these, for example, a CrossFit athlete on a rope climb, they're on the top of the rope, they fall down to the ground. I mean, that is very different, like that's very dangerous. But if you're kind of working in standard, exercises, push, pull, even push-ups, core work, ab work, for the most part, you don't have to make too many special considerations unless the individual themselves are uncomfortable personally. But of course, we want to avoid falls, avoid any sort of trauma to the abdominal area in regards to, if you're a boxer, you definitely don't want to be, in the ring, taking some punches, that's for sure. So just common sense stuff, early on is
So, avoiding high risk activities basically is
yeah.
that in a nutshell.
Yeah, for example, if you're, again, if you're into extreme sports, if you are I work with a lot of mountain bikers and a lot of snowboarders being out here in Colorado. Um, if you are someone that's maybe had a few miscarriages, you do want to make sure that you are not putting yourself in any sort of falling risk or just direct abdominal trauma for those first, that early phase. If you're someone that's had a lot of miscarriages, that might be another, you might wanna just, for as a blanket statement, take it a little bit easy just to make sure you're all safe and good.
Gotcha. So, blanket first trimester, there's not much to really worry about. So, I guess the biggest concern comes into the second trimester. So,
Sure.
you're
Yeah.
what
You
about
know
there? Because I know supine positions, for example, something you shouldn't be in.
yeah, so, exactly. So there's, the general considerations, with stuff like that. We do touch, a lot of the certifications do touch upon, that particular information of, not having women on their backs for extended periods of time, not having women doing a lot of excessive abdominal work. And that is absolutely true. Now, early second trimester, depending on the individual, depending on how much, how large they are at the moment, you may not have to worry about the supine issue for very long. So what happens is the weight of the baby actually compresses, a vein, and that's when they start to decrease blood flow, and then the woman will tell you this. They'll know. They're just going to start feeling lightheaded and dizzy. But the way to get around that is just to work on an incline. So if you are doing chest presses, for example, you can still do chest presses. Just make sure that they're on a slight incline. That will reduce any sort of compression, on that vein, and everything is totally fine. So you can still consider doing all those standard exercises, things like, a bench press, that's totally fine also. But just go with the individual, and that's a lot of, um, that's what's very important with working with a client who is pregnant is awareness and trying to get on board and learn to listen to what's going on to the body and get away from that idea that um, you're putting people into a box. And some women really want to be able to continue and pursue fitness throughout pregnancy. And it's okay. We just have to take some considerations, some modifications, and it is definitely doable. So again, like I was saying, if you're doing a bench press, something as simple as doing an incline, they'll be able to continue doing those bench presses. Now, another thing to consider is anything that puts stress or strain on the anterior abdominal wall. So, a lot of crunch work. So, anything that really focuses on the rectus abdominis specifically. And I'm not sure if you're familiar or your audience is familiar with diastasis recti. It's kind of a buzzword, especially in some of the more pregnant women that are um, more athletic minded, and that is really just a separation of the rectus abdominis muscle, putting stress and strain on the linea alba connective tissue that rests between the rectus abdomini. And as of course, as you can visualize, is as the abdomen gets larger in these women, the left and right rectus open up. And that's going to happen with 100% of pregnancies, 100% of women. The severity does vary from individual to individual. So there are, of course, we can't prevent it, but there are accommodations that we can make to help one support this diastasis and two ensure that it doesn't get worse because of things that we're doing to irritate it and cause it stress, which is all those anterior abdominal wall sort of exercises. So, no, we don't want to be doing crunches or V ups or bicycles. We want to be doing more deep core type of work, um, more isolation type of abdominal works. We can do, lateral abdominal exercises. We can do some side planks, um, bird dogs, things like that. So really bringing things down to basics with core work. That's another consideration that needs to start being considered right in that second trimester sort of area there. Hopefully that answers your question without being too wordy.
So let's talk about the diastasis recti, because like you said, it is a buzzword and something as a male that we don't hear about often. So I know, for example, a couple of male trainers, they had a client come in and say that they have this, and they kind of give that blank stare, like, what? Because it's not something that it's not in our books. It's not something we overly understand. But this is something that you can kind of talk about and maybe also address kind of a stigma that comes in mind with it. And I'll explain more what I mean. So it's separation of the abdominal wall. And for a lot of people, and this isn't just women in general, they still believe, even though it's been disproven a million times, that there's such thing as target fat loss, meaning if I work my core, I can lose fat around my core. And that's just been disproven so many times. But a lot of people are still working out this way. And knowing that, especially pregnant women, are prone to this diastasis recti, if they're doing these core exercises and with that thinking in mind, is this going to make it worse for them in general? Is it more likely that this is going to last with them postpartum and even years to come?
Okay, so just to clarify, so your question was if they continue to do, like, let's just say crunches
Correct.
throughout pregnancy with the mindset of thinking that if they continue doing crunches, that either one, their core is going to be just totally awesome after they have the baby and they'll have a six pack or whatever, or the belief that by continuing doing something like crunches, it's going to reduce a diastasis recti. Is that your kind of
Yes.
where you're going with the question?
Yeah, exactly.
Okay. Yeah, so that is a great question, and it is funny that you mentioned that because I do have, an ebook that I came out with, and it's for postpartum moms, so not quite yet ready for the postpartum crowd, but a lot of what I teach in that book can be applied to pregnant women. So the book, what did I call it? Because what do people ask for? It's called Flat Abs After Baby, and, that's what people want, and that's what's out there, and that's what's, like, online, like, I go into, Facebook groups, and it's like, "Oh, how do I lose this baby, like, pouch or whatever?" Or, "How do I prevent that baby pouch from even happening? Is this something I can nip in the bud, in pregnancy beforehand so that it's not there?" And, of course, you know the answer to that, like, no. And so I did call it Flat Abs After Baby to attract these women because they're the ones that I need to shake and say, you know what? What you do in pregnancy is important, but is more important in more of a support. It just kind of support the body and to not make it worse. We're just trying to keep it from kind of being an overblown situation where we're going to need a lot of therapy and a lot of rehab beforehand. So, your thought one is, by doing, core work or whatever during pregnancy, am I going to reduce the chance of having like belly fat afterwards? And of course, the answer is flat out no. We've got a lot going on with hormones. The body is just naturally, of course, expanding in that abdominal area. And a lot of what happens is the ribs are expanding, the hips and the pelvis are expanding. Um, of course, your abdominal muscles and soft tissue are all expanding. So, regardless of how many sit ups or core things that you do, you're, and I think there's a new term that I saw online, which is called um, like belly only pregnancy, in the idea that the only area of the body when you're pregnant that gains weight is just going to be your belly. The rest of you is like toned and ripped. And you see there's a few social media individuals out there that maybe were able to pull it off. Maybe it's filters. I don't know. But you can't really control fat distribution throughout pregnancy. There's just like get over it, get over yourself. There's a big hormonal component to it. And of course, you do want to make sure that you're watching what you're eating, but I can go off on a million tangents when it comes to that also. But back to the idea of the thought of doing, crunches to one, reduce a diastasis recti, or two, to reduce fat and that like belly hang after baby. Um, is actually kind of the opposite of what you need to be doing. Now, if you have a very weak, the muscle we want to think of is not really actually the rectus abdominis, anyways. It's actually more the transverse abdominis, where if you look at the transverse abdominis and the anatomy of a transverse abdominis muscle, it's more like a corset. It's actually what flattens the abdominal cavity when it is worked. Now, if you're working the rectus abdominis, what happens when you actually contract the rectus abdominis? Well, or if you grow the muscle of the rectus abdominis, it actually causes a thickening of the abdominal wall. So it actually gives you appearance of looking actually larger. So a lot of my postpartum work is actually more working on the transverse abdominis and that deep core muscles so that you're actually bringing everything back in together. So you can actually still work the transverse abdominis throughout pregnancy, and it certainly can help support something like the appearance of a diastasis. 100% of women It has been studied. This is like a stamp. 100% of women will have a diastasis at the time that they give birth. So, ladies, there's really nothing that you can do to prevent it. You can do something to help support it. So, like I was saying before with exercises, um, you really don't want to put stress on that rectus abdominis. So, actually doing crunches during pregnancy is it going to actually make that diastasis worse? If you do a crunch and you put your fingers between the two rectus muscles, there's actually causes a greater separation. So we don't that's actually what you don't want. You're actually doing the opposite. So those standard core, workouts that you used to spend 20 minutes just on the core, half an hour when it was core day, that's all you did. Those are actually making it worse for you in the long run instead of better. Again, we all know that doing like the thinking of isolating a certain area so that we can get certain results, like that whole spot theory, that of course that doesn't work too. So it's not going to work in pregnancy either. So women just kind of need to get over that.
Yeah, is there a favorite transverse abdominis exercise that you like? Because maybe some of our listeners are like, "What is that muscle?"
Yeah. So believe it or not, the it's a very difficult muscle to, of course, isolate if you've ever tried to do it because there's bigger muscles around it and supporting it. So the best actually exercise for pregnant women to do, believe this or not, and I get a lot of resistance with this, is actually breathing exercises and breathing techniques and visualizing that muscle being contracted. Um, so it's really actually you can control that transverse abdominis with breath alone. And it's perfect for pregnant women because that does not put any additional stress on the body. It's super safe and it actually really supports a diastasis recti during pregnancy and after after baby. So even just starting with a basic breathing to start activating it, to start feeling it, start knowing where it is and how it works and how to contract it, that's hands down the most important thing for women to start doing because it is one of those muscles that we've always just figured goes along with the package because we really always focus on, you do a crunch. And what happens if you do a crunch without the transverse abdominal muscle engaged? You see a doming. It almost looks like a loaf of bread, popping up on your abdominal wall as you do a crunch. If that transverse abdominis was engaged as you did a crunch, for example, you would see it's actually creates a flatter effect of the abdominal. So it's really just learning how to turn that muscle on and how to use it. So there's a lot involved in something like that. But
Mind
yeah,
to muscle connection.
sorry?
Mind to
It's a
muscle
muscle connection,
connection.
it's a muscle engagement, and it's something that, as individuals, we've never taught to learn how to feel and isolate that muscle.
Yeah, I like that a lot. Is really learning how to just engage it because you feel exercises so much more just in general if you know what muscles you're supposed to be working. Think about that muscle and then do an exercise. All of a sudden, a 1 pound weight becomes like, wow, I really feel it targeting and lighting up that muscle. So I do like that a lot, really learning where it is and learning how to engage it. I want to hop into the third trimester. But before we do, we're just going to grab a quick word from our sponsor, and we will be right back, guys. So stay tuned. Thank you to our sponsor, Hydronique Hydration Electrolyte Powder Drink Packets. Started in the midst of the pandemic, the founder of Hydronique Hydration, a frontline healthcare worker, started developing constant headaches. A landmark research study published early during the pandemic showed that 81% of frontline healthcare workers developed new headaches, mainly because of their PPE, which prevented them from eating and drinking properly while on the job. He would leave work tired, dehydrated, and burnt out. The founder looked for a healthy drink with all the necessary vitamins and minerals, but with no sugar. But most powdered drinks in the market have a ton of sugar and caffeine. That's why he created Hydronique Hydration, sugar-free, plant-based, antioxidant-rich electrolyte powder packets for daily use containing all essential vitamins and minerals with a refreshing taste. Their product contains elderberry, which is known to have immune boosting properties, especially during the cold and flu season. Hygienic Hydration electrolyte powders can also fit in your bag or suitcase when traveling and are super convenient just to carry around and have with you day to day. So if you're having trouble with eating and drinking healthy during your busy day and want a great alternative to other high sugar hydration companies, then give Hygienic Hydration a try. There are 30 of these great electrolyte powder packets in a pouch, perfect for a 1 month supply. You can visit www.hygienichydration.com. That's www.hygienique hydration.com. It's the word hydration and unique mashed together. Or search Hygienic Hydration on Amazon, where they are offering a $10 discount coupon at checkout. Anyway, guys, links in the bio. Please go check them out. Thank you again to our sponsor, Hygienic Hydration. I drink these packets almost every single day. They also have a ton of great vitamins and nutrients in them, including vitamin C, the elderberry mentioned, magnesium, and zinc. So even if you have a little night out with too many drinks, or you had a really good workout, because I hope that's the reason, grab one of these packets today, pick it up. Now back to the show. Hey guys, and welcome back. We're going to hop right into the third trimester, which is probably the most important one just whatsoever, because at this point you're, I'm sure, just what do I do? Help. I'm really showing. I'm really pregnant. Walking is tough. So take us through what that's like and if you should be exercising, or at this point you're just leaving it all up to your physician about what kind of stuff you should be working on.
For sure. Yeah, that is a good question. And again, it's all individualized. So if you're carrying triplets, this answer is going to be different. If you're an old pro at this, you've been, maybe been pregnant before, then it might be a different experience. So again, um, there's no like black and white answer to all this. And of course, having, like you had mentioned before, having a good relationship with your trainer or having a good relationship with your client, if you are a trainer, and then also having good relationship with your doctor, if you have a physical therapist, all that sort of stuff. And the most important thing to remember, especially in late, third trimester, even second trimester, if you're not having the best, most comfortable pregnancy, is really being in tuned again to your body. And you want to start looking out for some warning signs. So things of pain, discomfort, fluid leakage, shortness of breath. If you're having contractions or if you're dizzy, you really want to respect your body and your baby at this time and actually throughout the whole pregnancy. If you are winded and shortness of breath, that's your body telling you, let's sit down, let's get that heart rate down, let's get that breath back again. Because, most women, especially my athletes here, oh, I can always fight through, um, you know, i- if it's hard to breathe. I love that. That means I'm doing a great workout. But you have to remember, if you're not getting enough oxygen and nutrients, your baby is not getting enough oxygen and nutrients. So just because you can push through and continue on, probably not a great idea. And I sit down, take a breather. If you're overheating, if you're dizzy, let's just nip that in the bud here. So you want to, respect your body. Again, anything that's front loading the abs again, so all your crunches, your V-ups, a lot of your planks, a good way to modify a plank if you are still hard set on doing planks, is to do an elevated plank, something like that, that's going to reduce some of that pressure on the abdominal wall, but still allow those core muscles to get some engagement, some isolation. And, another thing that I forgot to mention before, but super important, is Really stop comparing yourself to other pregnant women or even other women in the gym who are not pregnant. And I do see that a lot. So if your girlfriend is not pregnant and she's still working on some pull ups, don't compare yourself to her. That's really not helping the situation. So, you really do want to start considering making bigger considerations on how to adjust your workouts. And again, every day is going to look super different. You may have so much pressure and pain going on in your pelvic floor muscle that things like running, even things like lunges, jumping, anything plyometric, that might be uncomfortable for a lot of women. So that might be something to scale back or even modify. Of course, I start seeing women in the CrossFit gym that should probably start reducing things, momentum based exercises, things like kipping or going upside down. Like, holy cow, it might be time to start considering changing that. And of course, weightlifting is something else to consider too, and it depends on if you are like a competitive athlete or not. I do see a lot of competitive women who lift, who have, and I do actually, um, know a lot of competitive weightlifters that have been pregnant, and a lot of them have noticed that after baby, going back into lifting, because their muscle memory has changed, of how they had to adjust their bar path when they were doing some lifts, it actually kind of like messed them up mentally. So realize that as you get larger, it's going to be difficult to go through that same bar path. So if you're doing a clean and press or something of that nature, notice that there's a belly in the way all of a sudden. So you might have to switch to something like dumbbells or kettlebells so that you don't have to worry about that belly kind of getting in the way. That's definitely something to consider as a lifter. When it comes to the consideration of being supine is, more prevalent during this later stage. The belly is larger, there is more weight there, so it's going to put more pressure on, organs, arteries, veins. It's going to compress everything down. So this is more of the time where you want to consider not spending as much time in that sort of supine position. Being elevated is, super important. Of course, again, it's really just listening to the body and what's happening. So you can really still take women through the same exercises or similar exercises. You might have to break down a workout too. So if you find that, previously used to do an hour workout a day, you might have to cut that short, or you might have to break that up into 10-minute chunks throughout the day. Um, my last thing that I would want to mention is anything that causes pressure or pain in that pelvic floor area is just something to consider and support. A lot of times, things like lunges or movements where you are off balance, that is going to potentially, cause the hips to, sort of dip or cause some pain in, like the SI area. So watching out for that. A lot of women will start to experience a lot of SI pain and pelvic pain towards the end of their pregnancy. So really just offering ideas to support them through that. So they might have to change their stance. They may not be able to go as deep into a lunge as before. Totally acceptable to do modifications in that realm. And I can certainly talk more about pregnancy modifications, if that is something that interests you for sure.
I actually want to move on because I got some interesting questions for you.
Cool.
And I'm sure a lot of people think this, they just don't want to say it out loud. But the first one is more of a simple question. Is exercising while pregnant better for the mother as far as postpartum giving birth? Is it the weight come off a lot quicker? Do they feel better afterwards? Which I think that's a pretty obvious answer, but something worth talking about. But the second question, I'm sure no one's asked before, is it better for the child? Is there any research that shows a mother that's exercising while pregnant will be the child will actually be better off or at least healthier in that aspect.
Sure, sure. Okay. That's cool. I like that. So back to your first question, that is um something that I hear like very often is um because I've worked out during pregnancy, am I going to have a better postpartum experience, individually? And the answer is not so black and white. Everything is a maybe with pregnancy. There's no certain, like, there is no definites, there's no certainties, and I apologize for all of that. But I will tell you that one of the biggest factors to pregnancy outcome is not necessarily how you've gone through your pregnancy, although there are some benefit there, and we'll talk about that a little bit. But there is so much trauma that can potentially go on during that delivery and labor processes that could potentially mess up any gains or whatever you have done during your pregnancy. So there's no guarantees. So you can get to that finish line and still fall off the edge. There's no guarantees with that. So without being too, graphic or dramatic, you know, some women have an unplanned C-section, some women have an unplanned episiotomy, there's just so much that goes in there. So I will say that, you know, labor and delivery is traumatic for the body. It's like you had an injury. It's like you busted your knee. It's like you busted an ankle. Um, can you have like a mild sprain when you bust your ankle, or can you have like a full on breakage? So we don't know what's going to come out in the end. But yes, strengthening the muscles, the ligaments, and the tendons through pregnancy, making sure that you are supporting yourself and your posture through pregnancy, all those little muscles that have changed, that can, yes, help you with your outcomes. But unfortunately, it's not 100%. There's no guarantee there. Um, I just don't have a better answer for that,
It's all
unfortunately.
good.
Wish I could tell people. But let's say, for example, you continued to work your biceps during pregnancy. Yes, after labor, you go back, you're still going to have some nice biceps. Like that is guaranteed. But when it comes to the core and the pelvic floor and some of the additional, of course, through pregnancy, you release a lot of hormones that are geared towards relaxing all the soft tissue. So a lot of times there are some issues that come with that later on and going back into strength. You lost a little bit of strength there because of the integrity of your soft tissue has been lost. And that hormone continues to go on if you're breastfeeding and things postpartum. So that's a whole other can of worms. But the short answer is no guarantees. Yes, it can help, but it's not a guarantee. So hopefully, hopefully people are still encouraged, to work out. And then on to your kind of part B or second question is, does it benefit the baby? And the answer is, again, yes, there is data, and that's why a lot of overweight women who um, get pregnant are encouraged to do some sort of exercise, like walking or whatever. Is again, like I mentioned before, considerations like gestational diabetes, preeclampsia, things like that. It is important that a woman remains healthy, eats well, not just exercise, because we do know that a lot of diet is a huge component in things too. You can't be eating burgers and fries and sitting on the couch all day because you're eating for two. The health of your baby, what you do is a reflection of what is happening to your baby. However, a lot of women, a lot of athletic women, we take it to the extremes. Like I was saying before, considerations like if you're not, if you're working out and it's hard for you to breathe. It is, you're gasping for air, you're dizzy. That means your baby's not getting oxygen and nutrients. So yes, you can do a disservice to your baby. We all know that when we exercise, we have those endorphins. We feel better. Yes, I don't know the data behind it, but I'm pretty sure the baby gets some of that too. So, if you're a happy mom, you are in good spirits, I'm sure that reflects on the baby. Also, I'd love to see some data on that now that you mentioned, that we're talking about it. But it is a good thing, but it can be taken to the extreme. We can harm the baby and we can hurt the baby by exercising, but there's also so much benefit too if we're doing it properly. We're doing it with special considerations. Absolutely.
Yeah, just two different extremes, and just I don't want to harp on this conversation,
Yeah.
but one side eating a really poor diet and not getting the proper nutrients your body needs is going to hurt the baby. But on the other extreme, somebody who's too strict is probably in a caloric deficit, which means that the baby's in a caloric deficit. They're not raising their calorie needs, not realizing that they need it for their womb and to help the child grow and develop. So everything in moderation is something we learn at a young age, and really
Yeah,
just
it
goes a
rings
long way
true
with
for
this.
this. For sure, yeah, and yeah, exactly. Nutrition and exercise, you really don't wanna be on either side of the fence. You wanna be in that happy medium. Um, Again, we're just trying to do the best, as we can here, and, a lot of the women that go to the extremes, it's because 'cause they're thinking of themselves, and, we really want to kind of bring this back. What's best for my child? What's best for me? How can I best support my baby today? Those are all things that we should think about when going forward with our workouts. Do I need to be doing this? Is this supporting me? Is this helping me achieve, the goals for myself or helping me, better my pregnancy or the results for my baby? Am I doing my body a service?
Yeah, I really couldn't agree more. I'm not going to change my last question, my last two questions that I asked everybody,
Okay.
because I want to get a little more of a specific answer. Is what's one of the most frequently asked questions you get from your clients, and what would the answer to that be?
The most frequently asked question I get is, "Can I do this or that?" Um, that's really what I hear across the board is, can I run? I love CrossFit. Can I keep doing CrossFit? Can I still doing this? And the answer is always, um, if I say no, you're going to be mad. You're going to be depressed. You're going to have a miserable experience. So I never say no. I'm one of these one of these people that never says no. But I say yes, but there's always special considerations. Again, that's going back to the extremes. Let's figure out a way that you can continue to do this, but do this safely. And that's usually my number one concern is how can we do this and how can we do this safely so that you're happy and your baby's healthy.
Yeah, just do what makes you happy, and just for the best of the both of you at that point.
Right. Yeah, there's always some way to hopefully, make both parties happy. Absolutely.
I love it. And the last question I always ask everyone, Daisy, is how can people find you, get a hold of you? Where can they find your book? Take it away from here.
Yeah, so the best place to find everything that I offer is on my website, which is strongmomsfitness.com. And that's moms plural, MOMS. No like fancy, like, um, what's the word I'm looking for? I'm not no like special, like weird ebonics, like way to spell it. It is clear strongmomsfitness.com. On there, I have a pregnancy do and don't freebie guide, which goes through a lot of what we talked about today on, what to do, what not to do. If you like to do certain exercises, how can you modify it? Really, awesome guide that goes through all that. And of course, if you are someone also that is concerned with, core and abs, maybe you're still pregnant, but my ebook that I had mentioned before, The Flat Abs After Baby, goes into more of what we were talking about earlier, how to start using that transverse abdominis. And a lot of what is taught can actually help you in the pregnancy phase, not just that postpartum phase. So, I've got a lot of cool stuff on my website to help you through your pregnancy postpartum journey for sure. So strongmomsfitness.com.
And there is so much more we could talk about in this topic. And I just really want to emphasize that we really only hit fitness and didn't even get into nutrition or mental well being or everything else that could be
For
related
sure.
to pregnancy. So if you guys have any specific questions, maybe we'll have Daisy back on. We'll dive a little more into the other side of this topic. But I want to thank you guys and thank you for joining us on this week's episode of Health and Fitness Redefined. Don't forget, hit that subscribe button and join us next week as we dive deeper into this ever-changing field. And remember, fitness is a journey, not a destination. Until next time. For us, we know what it's like to feel unhealthy, depressed, and downright defeated. We want to show others there is a right way, and through fitness, you can do anything you set your mind to. Fitness can give you that motivation, confidence, energy you need to bridge that mental gap and prevent you from missing important life events. We understand it's about feeling better, living longer, and being good examples for our kids. We understand this because we live it. And for us, that's the redefined difference.